Good afternoon. My name is Connie Schardt and I work at Duke University in Durham, North Carolina. And I want to extend a warm welcome to all of you, especially my students in the EBM and the medical librarian class. Over the years I've had the privilege of working with many of you through that class. I also got an opportunity to meet some of you last year at the ICML conference, and that too was an extraordinary experience. I have really enjoyed working with you all. I was reviewing the agenda for your workshop today, and it looks like you've covered a lot of ground in a very short period of time, and that certainly is commendable, and I bet you're all ready to go home. But at the same time, I hope that it has whetted your appetite for more learning. There's a lot to learn in evidence-based practice, and it's hard to understand and fully comprehend all of the concepts and all the issues in a single workshop. I've over the years have attended many workshops, and in fact I attended the McMaster workshop for 8 years. I have to tell you that it does take practice. I remember when I first got started and heard things like concealed allocation and intention to treat and all the issues swirling around critical appraisal. It took me a while to fully grasp them to the point where I could explain them to somebody else and that I could use them in my own librarian work. It is important that librarians be comfortable with the concepts of evidence-based practice or evidence-based medicine, because so much of the work that we do is built around that EBP framework. Whether it's collection development and making sure that our clinicians have the right resources that are evidence-based that can be used at the point of care, or searching so that we can find the right evidence to answer their questions, giving a value-added service so that we just don't hand them a list of citations, but we hand them the study designs and the level of evidence that are best suited to answer their question. For me, I focus a lot of my attention on education. I'm involved with medical students and teaching EBM. And not only clinical question building and searching strategies, but we do a lot of teaching of critical appraisal. That's part of information management and making sure that our learners, whether they're students or clinicians, know how to appraise and evaluate the information that they're looking for. I do a lot of team teaching with clinicians, which gives a bit of credibility to the library and makes for an interesting learning situation. I think understanding the concepts of evidence-based practice also makes us good consumers of the literature. I don't know if health literacy is an important component here in Australia, actually over there in Australia, but health literacy is a pretty important issue for our patients, because as our clinicians become more aware of evidence-based resources, that is filtering down to the patients and being sure that patients also understand what is the best research, especially when they're out there on the internet. So what we saw when Angela and I were doing the evidence-based medicine distance education course is that was a good experience. That was an extended period of time where our learners for 8 weeks were involved in evidence-based practice. What we also saw was that they needed more learning and more time to practice in a supportive and unthreatening environment. And so we came up with the idea of a residential workshop. It's come to be called the Dartmouth Evidence-Based Practice Institute, and we are in our 3rd year of this workshop. In fact, tomorrow I'm flying up to Dartmouth to begin the workshop Monday evening. Now, this workshop is for librarians. It was developed by librarians, and it is taught by librarians, and it combines general content, large group lectures, with small group interactive settings where we practice the basic concepts of evidence-based medicine. And along the way we try to demonstrate interactive learning styles and exercises that librarians can use when they go back to their institutions and do some of this education and training. We cover, for the first day, we cover clinical question building, study design, searching and finding evidence. And we spend the whole day in interactive sessions, working on clinical problems and following the evidence-based medicine framework. Second day we cover therapy. We have a large lecture that talks about the critical appraisal components of a therapy study, and I think you got a little bit of that today. But then we break into small groups, and we've got a number of innovative activities that help us practice that content and those knowledge and skills. We actually take articles and look at them in more detail and look to see do they have the criteria that are necessary for a good randomized controlled trial. We cover the same process for systematic reviews and questions of diagnostic testing. On the last day, we have some concurrent sessions that go into a little bit more detail for some specific topics like nursing, systematic reviews, teaching styles and exercises, and a special session on looking at the results for those of you who like to keep crunching the numbers. We've gotten very good reviews of the Dartmouth Institute. This is our third year, as I mentioned, and each year we have filled the course to capacity within just a few minutes of opening up registration. So it has become a fairly popular course. We offer it for a set fee, and we have the students stay in dorms, and we include all meals and accommodations in that one fee, which makes it very attractive. Well, as Angela and I were talking and thinking about our distance education course and all of the Australian students that participate in that each session, we began to wonder if it might be feasible for us to come to Australia and try to duplicate or put on the Dartmouth Institute. So I began talking with Lisa Cruci about this. Lisa had taken the course, and I worked with Lisa in the past and of course met her again at ICML. And we began to think that maybe this would be a good opportunity for your librarians to have a residential workshop that would really immerse you in the evidence-based medicine components and give you a real foundation and grounding in these concepts. So we have begun to do the planning. We've looked at some areas and some locations to possibly house the workshop. And we're targeting, I think, next November 2011, and perhaps make it a 3-day workshop and invite medical librarians from all across Australia to attend. And one of the things we want to do with this workshop is make sure that it meets your learning needs, and so we can customize the curriculum. So I guess what I'm doing with this little video presentation at the end of your workshop is to find out if there's interest in additional training, if a residential workshop would be something that you would be interested in, and what are the areas, what are the topics that you would like to see more information, more content, and more time to practice. So I think over the next couple of weeks, a couple of months, we're going to be doing some needs assessment and talking to some of you and getting some idea of what the content should look like. We'd also like to hear from you whether or not you think this is a good idea and how many of you might be interested in attending. So I wish you all the best of luck. I know you've had a filled day of educational activity and a variety of speakers, and it all looks very exciting, and I wish I had been there in person. But hopefully I'll be able to come out next fall, and we can spend some days together and review some of this content, and hopefully make you more comfortable and secure in practicing evidence-based medicine and incorporating it into your library services. So I wish you all the best of luck, and please, when we ask for feedback, give us your feedback about what you would like to see happen. And perhaps in November we will have the Brisbane EPB, Evidence-Based Practice Institute. Thank you very much, and good day.